Hi everyone, how are you? Welcome to another question and answer session. This is a physiology portion of MRCS exam. Here, this is the question: which of the following does not decrease the functional residual capacity? So here we have to find out the factor which not decrease the functional residual capacity. Here the options are the obesity, pulmonary fibrosis, muscle relaxant, laparoscopic surgery, and upright position. So first of all, let's see the functional residual capacity. So this is the functional residual capacity. Residual capacity, actually it is the capacity, or it is the volume of the lungs which is usually not expired from the lungs. That means a amount of air present with the lungs which is not expelled. So here we can see the volume of the air remaining in the lungs after normal tidal expiration, and it is here we can see functional residual capacity is the expiratory reserve volume and reserve volume, and it is 2300. That means 23 hundred ml. So this amount is the functional residual capacity. But this capacity may be changed according to the different physiological condition. Here we can see the residual volume here and residual capacity up to this, and here we can see this capacity usually present in the lungs when the normal expiration occurs. So the functional residual capacity, it increases in different factor, such as in erect position. In erect position, the lung volume increase due to gravitational factor. Here we can see, imagine this is a lung, and up to there imagine up to this is the functional residual capacity. But when a patient is stunned, then the lung length usually increase, such like that. For this condition, the functional residual capacity also increases. Then second condition is the emphysema. In emphysema, total lung volume is increased. So when lung volume increase, there will be increased functional residual capacity. Also the asthma. In the case of asthma, the functional residual capacity increases, because in this condition, patient takes breathe, and the functional residual capacity is increased, and patient feel difficulty for taking inspiration. And some of the condition where their functional residual capacity is decreased. Functional residual capacity decrease in that condition when normal lung volume decrease, such as this is a lung volume. For any region, lung volume reduces like this. So in this condition, functional residual capacity also reduces. So first of all, here we can see pulmonary fibrosis. So any type of fibrosis, their contraction occur, and the size of the organ or size of the site will be decrease, and this condition functional residual capacity decrease. Then here we can see laparoscopic surgery. In laparoscopic surgery, the abdomen, in abdomen there carbon dioxide in introduction occurs, and in this condition the abdominal volume increases, abdominal pressure increases, so lung cannot expand properly. So in this condition also functional residual capacity decrease. Then obesity. Here in case of obesity, there is more abdominal fat, so it is difficult for lungs to expand. So is this condition also decreases the functional residual capacity. And also the abdominal swelling or abdominal tumor, it occupies the greater part of the abdomen and causes decrease residual volume and capacity, and also the muscle relaxant. So our answer, which does not decrease functional residual functional capacity, that means which increase. So we have to find out a condition is which the lung volume increase. First of all, here we can see the obesity. Obesity, it cannot increase the Lung volume, actually the obesity causes decreased lung volume. Then here we can see the pulmonary fibrosis. So any type of fibrosis, there will be decreased size of this organ. So in this condition, functional residual capacity decrease. Then muscle relaxation, it also decreases the functional residual capacity. Laparoscopic surgery, it also reduces because the abdominal volume increase, and upright position, it is right because due to gravitational force lung volume increases. Thank you all.